way that we think about, which is, you come up close to someone that's less than 3 feet away, that person has infection, particularly if they're symptomatic. So they're coughing and sneezing. It makes sense that that's the highest risk. Whether or not we can academically say that, you standing across the room and can still get it. Again, I'm always humbled by clinical medicine. I can't give you an absolute zero risk. But again, knowing the nature of this beast, I think the risk is really minimal, if at all. And I think people should really focus on what's the highest risk, not think that, I can get it from anything. Because I think there are things that people can do on a personal and individual level that can really substantially decrease that risk.
I get it. You definitely want folks to focus on the most impactful actions they can take, right? All right, good point. Let's start with our viewer questions. I want to start with Christopher's question. Christopher Ian Garcia asking on Facebook, as someone with asthma and fibromyalgia, should I stay home from work until this is all blown over and the virus beaten?
That's a great question. I've gotten lots of questions from patients who have asthma or reactive airways disease, particularly it's allergy season too. So I think a lot of people's asthma, it's acting up just because of the pollen in the air and everything. I'd say right now, and again, we have a lot of data that's continuing to be analyzed. It seems that we're getting data every hour in COVID-19. An hour in COVID-19 is like worth a week or a month in regular time. So right now we don't have convincing data that having asthma gives you an increased risk of getting COVID-19. However, people with asthma do have a harder time with any respiratory tract infection, even the common cold or, influenza. So I would think about that the same way, meaning that, again, try to stay away from crowds or from situations that you can control, if at all possible. And that's the way I think about it.
All right. Over the weekend, I've seen a lot of articles also about the increasing acceptance of the idea of maybe for everybody to wear a mask, not just those in the healthcare profession. So here's a question that is being posed by Ellie Mads Ramos. She says, what can you say about reusing surgical masks? And I'm not sure if she's a healthcare worker or not, but what do you say about reusing, and if they were to reuse it, how would you handle the sanitation aspect or the sanitizing?
So I would say, if at all, generally with surgical masks, we don't like to reuse it too much. It's a little bit different from N95 masks that are a little bit more sturdy, and they have a little bit more structure around it. But with surgical masks, it's kind of like a piece of high quality paper that you're putting across your face. So you can imagine that even with paper, it can get crumpled or like the structure can get undone a little bit. But if you do have to reuse it, these are the tips that I have for people. You hold the mask, the ends of the mask with your hands and not touch the front of the mask. You try to at least keep the inside of the mask a little bit clean as possible, because that's what's in contact with your nose and your mouth, and not the outside. The outside, again, it's kind of like the dirty area, and the inside, you want to preserve that at all possible. But even before that, I think holding it by the ends, by the strings, as much as possible. When you're done with it, putting it in a bag, so at least you're trying to not touch it as much. Those are some of the tips that I think can help people.
All right. Brenda asks, after being exposed from someone that was positive COVID-19, should I keep myself away from everything for 14 days and then I can go run errands?
That's a great question. I think that if we didn't have shelter in place in California, it probably would be a different kind of answer. But I feel that if you're responsible and you're trying to maintain safe distance from people, or putting yourself in a situation where you can control the environment, there'll be very little likelihood that someone would get infected from you, even if you were exposed to someone. I think if everyone stayed away from all the things that they enjoy because they might have been in touch with someone who might have COVID-19, all of a sudden we wouldn't have a workforce out there. So I feel even in the hospital setting, what we advise employees is, even if you were in contact with someone, we ask you to watch yourself carefully for symptoms and maintain community responsibility.
All right. You know what? This is an interesting question because I've also read a lot about how blood donations are down, and that is problematic for the availability of the blood supply. But at the same time, Diane asks, with all this talk about people who have no symptoms but may be carriers, how does the blood donation screening address this?
That's a great question. I think we don't think that COVID-19 is spread by the blood, luckily, unlike HIV, hepatitis B, or hepatitis C. So I think blood screening is less important, luckily and fortunately for us. So there isn't need, I think, scientifically or medically for blood screening. There's actually very little, when they actually looked using molecular techniques for the virus in blood, there's very little, if at all. And so it's controversial whether or not it's a thing. So right now, there's no evidence for blood-borne transmission of the disease. And it's really a traditional cold-like, you breathe and cough on someone and it travels on that drop to your nose or your mouth, not via the blood.
All right, Dr. Ching Hong, we'll take a short break on air, but we'll continue the conversation, of course, online, streaming on Facebook. And then after the short break, we'll come back on air to answer more viewer questions as well. Stick around.
And we're in commercial break.
All right, Dr. Ching Hong, let's continue with viewer questions. Here's some really good ones people are posting right now. Sue Irving Smith wants to know, my roommate works in a grocery store, and even though she is careful, how much risk am I taking? So I guess someone that she lives with is sort of kind of, exposed by having her grocery store job. So then she brings it home. How about the risk to the roommate?
No, that's a great question. I often worry about people in grocery stores, particularly the employees, because they can't always maintain social distance. So, I'm going to Safeway and the cashier is right up there with me. And I'm like, I bought a lot of stuff and I'm standing there less than 3 feet away from that person. So, or the person at, stocking the shelves, and I come up close to them to get something. Again, a transient crossing of someone is probably not going to give you a lot of risk. It's like maybe that cashier who's like up close and personal for a long period of time, particularly if somebody's coughing or sneezing. So if you're working again with somebody in a situation where they can't necessarily control the environment, I think it applies the same answer I gave the last one question about, what if I was exposed to somebody with COVID-19 would apply as well. So I think maintaining safe distance as much as possible, even in the living environment, is a good thing. Cleaning your surfaces at home. I think your roommate would understand how you're feeling. I mean, these are different times after all. And doing the best that you can to at least keep yourself, safe and healthy and happy, and not worrying too much about it. Because again, we can't make risk zero, but we want to try and do the best that we can.
All right, sounds good. We're coming back on air, so get ready. Here we go. We are back on air now with Dr. Peter Chin Hong of UCSF. If you followed us on live stream, then you heard Dr. Chin Hong answer a couple more questions, so we're going to keep that going now. Actually, this one comes from me because I'm really concerned for you, those of you who are working in the hospital setting. At UCSF, where you are, what have you seen in terms of what's happening now in terms of the infections of both the workers and also whether you guys have all the gear that you need. But really, I'd like to know what you know about the rate of transmission within your hospital community.
I think certainly our experience reflects the experience of other healthcare workers across the country, meaning that people are infected. We're not really sure because we don't have that level of analysis where they got the infection. We actually think most of the infections that healthcare workers have were obtained in the community. We can't say for sure. And there haven't been too many documented infections. Like when we have a TB outbreak, for example, we can trace it, and it's usually within the hospital or multi-drug resistant bacteria or C. difficile colitis. But I think with COVID-19, it's really tough to disentangle the community. I think the community risk is bigger. We can make the hospital a cocoon, but again, you can't control the community.
Yeah.
And we're trying to make the hospital as safe as possible.
Right. But as of Friday, you all started wearing masks, right? That is a rule to enter. You must have that mask. Okay, I want to address a couple of questions with regard to drugs. Both from Edora, who asked, what medications have you tried that seem to be working for COVID-19 patients right now? And well, let's start there, and then I have a second drug question.
Great. So I think about drugs for COVID-19 like the Olympics. There's a gold medal, a silver medal, and a bronze, and the people who dropped out of the race, so they get, hit in the knees and they fell out of the race. So there's no gold medalists because we don't have great data. The silver medalist is a drug called remdesivir. It's an IV drug given intravenously that people might have heard about in the media. It's developed by Gilead for Ebola virus, and then they brought it out to repurpose it for COVID-19, which a lot of people are enthusiastic about, but I think we need data. And right now, unfortunately, because we have so many cases, we are going to get the data because we're enrolling people in trials. There's another way to get that drug, which is originally through a compassionate use program through Gilead, but now it's been retooled into an expanded access program. Slightly different terminology for a different way of getting it. Mm-hmm. But I think we're trying to get people in the studies as much as possible first to make sure it's effective. And then what will happen, it'll be released to everyone.
Yeah. I mean, because between what the president has suggested about some of those drugs and then also some celebrities who have gotten sick and kind of announced what their cocktail of drugs, was, there's a lot of controversy about what really works.
Totally.
But your message is, look, there isn't an answer right now. We're working on getting that data, getting the answers. All right, so that's helpful.
And I just want to make one more point, Kristen. Some of those drugs are dangerous, actually, for people to take on their own, like the stories in Arizona, the person's, drinking or trying to take the aquarium supplies because of that chloroquine in it. So I think for the community, really try to do this with the help of your primary care or specialists because it can be dangerous.
Okay. Now, Sheila Feliciana asked on Facebook of us, I had Mrsa in 2006. I hope I'm saying this right, mupirocin or is it mupirocin work in the nose?
Yeah.
Okay, will that work?
That's a great question. Mupirocin is an ointment that some people put in their nose to help against eliminating the carriage of Mrsa because it kind of loves the nose as well. It's a bacteria though, not a virus. So it probably wouldn't work against COVID-19, unfortunately.
Okay. All right. That's good to know. Carlos Hernandez Mendoza says, if you're type 2 diabetic, do I have to stay home? Also, I have an ear pain and throat. My nose feels a little stuffed. Would that be something to be concerned about with regard to that being coronavirus?
So two great questions in that question. The first question is whether or not you should stay home if you have diabetes. The answer is no. Again, I think about people with diabetes as having the same risk of getting it. Whether or not you get sicker faster is another question we're still trying to figure out. The second question about, what was the second question? I actually forgot it, unfortunately.
Oh, yes, just that, he has ear pain and throat pain and his nose feels a little stuffed. So are those potential symptoms?
Great question, because a lot of allergy symptoms right now, it actually is not a feature of COVID-19. So I would assure and reassure the community, because if you have allergies, it's a good thing. It's likely not going to be COVID-19. We know that from over 3,000 patients in China already.
Okay. Hey, Adrian wants to know if you have an approximate time you think when the surge is going to happen for COVID-19 in the Bay Area. And, this is kind of tied into my own question of, is our sheltering in place working? Is that surge coming a little later now? When do you think that might be?
So it's hard to say if we're flattening the curve. I think we're optimistic in SF, but again, we don't want to count our blessings too early, and we're following this very carefully. I think that, we may have a mini surge, maybe with, nursing homes in the area, et cetera. But whether or not we get a huge surge like what was seen in New York, I'm hoping that we don't. And I really, in my heart of hearts, think that our shelter-in-place policy will help us with that.
Yeah, I certainly hope so. But we got to keep it up. We can't relax, right? Let down our guard.
We can't relax. We can't be complacent. We have to keep it up.
Okay. So Terry Dean has a question. She wants to know, how do you care for a loved one if they get sick with coronavirus? Like, she wants to know about how to prepare your home, what proper supplies to get to be ready.
So I think about some P's with helping to prepare your home with for taking care of a loved one with COVID-19 if you didn't have it. And that's like making sure you protect yourself. So, if you are taking care of a patient or loved one with COVID-19 intimately, of course you would be as a caregiver. I think in that situation, it would be good to have a mask. because again, you can't control that transmission. Again, when people get discharged to home, they're usually well enough and their clinical criteria will be used in the hospital to make sure that they're not transmissible. But again, you want to probably take that extra step in case. The other things like, again, cleaning surfaces, having a place where you can communicate with that person effectively. A lot of people are using FaceTime or iPads, so you don't have to come up close to someone all the time. You can keep up that love, keep up that communication.
All right. We don't have a lot of time left, but a couple of good ones, so hopefully you can get to these quickly. Leilani Lee wants to know, can COVID-19 enter through cuts or open wounds and sores?
That's a great question. Again, the nature of the beast is a droplet going into your nose or your mouth, not blood-borne. So I think just like that other question about the blood supply, it's not going to happen as we know it right now.
When washing your hands, somebody wants to know on Instagram, is a regular Barb soap just as good as antibacterial Barb soap?
Totally. A regular Barb soap is great. You don't have to buy a special soap. The main thing about washing hands is the time, not the quality of soap. So remember, sing Happy Birthday twice or sing some other chorus like, Africa's by Toto. It actually is around 20 seconds.
All right. How much time do we have left? Do we have time for one more question, guys? We do. Okay, great. So shouldn't people be wearing clean masks and gloves in stores since many people are carrying the virus? And I know that's a tough last question, but I really feel like that is the heated debate from this weekend. Should we be wearing masks when we are, let's say, on transit or in grocery stores, or just cover our mouths with a scarf?
Yeah, so I get that question a lot from the community. I think it's a really valid question. And again, if you look at the subway platforms in New York today, for example, you see a lot of people crowded together. New York has a surge right now. I probably wouldn't be on that subway platform without some sort of protection. And you don't have to be having a mask. You can wear a scarf or a bandana.
All right, Dr. Peter Chin Hong from UCSF, thank you so much. I know how busy you are, so to spend this time and answer our viewer questions, we really, really appreciate it. Take good care.
My pleasure.
All right, we'll see you again soon.
Definitely.
Folks, if you did not get to have your question answered on air, we are going through the live streams after the show to pull some for our next doctor that we will have on this week. So we'll get to you. Be sure you're watching and be sure you're posting your question. All right, we're going to take a short break on air, but I get to talk with you on our live streams, including Facebook Live right now. So if you want, you can join us over there.
In commercial break.
All right. Hey, folks on Facebook, do we have time for one more question with Dr. Chin Hong? Or, okay, we don't. Thank you so much. I really appreciated that. I hope you found that information useful to you. And again, if we didn't get to your question, we'll definitely be able to get to it next time. Or I shouldn't say definitely. We're going to try. We're going to try our very best. But there are a lot of questions indeed, and I get it. All right, right now we are connecting with our next guest coming up. Some of you might know her because we've done stories on her work in the past. Her name is Heidi Kuhne, and she is with Roots of Peace, based here in the San Francisco Bay Area. And they've done a lot of great work in Afghanistan and other parts of the world in terms of ensuring that people are protected from landmines, and also to support women starting their small businesses in Afghanistan. But she has a unique take on this today. So we're setting that up. Hi, Heidi. How are you? This is Kristen. Thanks for joining us.
Including me. Are you on a station break now?
Yeah, we have like 45 seconds before we come back
Okay.
live. Heidi, is it Kuhne or Kuhne?
Kuhne,
right?
Thank you.
Okay.
Mhm.
Yeah. You emphasize that you Kuhne. Okay.
Kuhne.
Yep.
Cum laude.
You guys staying safe?
Yes, trying
Okay.
very hard.
Very
90-year-old father and two children who are doctors on the front line.
I know. I'm thinking of you.
Thank you. And thank you, Kristen, for taking this on the high level. You know, I'm happy to, more than proud to say I have two doctors in the family who are on the front line and administering the tubes. Yeah, but let's just not be specific about UC Davis or the VA hospital.
You don't say it, I won't say
Yeah.
it. Okay, we're about to go on here in 10 seconds. So,
Starting on camera in 4, 3, 2, 1.
All right, folks, welcome back. The situation for healthcare workers, as we've discussed on the front lines, is really dire on several fronts. Joining us now is the CEO of Roots of Peace, a Bay Area nonprofit which has done amazing work protecting children from landmines. CEO is Heidi Kuhne. Heidi, thanks for joining us. So good to see you again.
Thank you, and thank you so much for all the good work ABC7 News is doing.
Look, I know you spent your lifetime supporting other people in need, but now, you know, the situation's kind of reversed in that you're in need, or at least your children. And as a concerned mom of 2 kids who are doctors, who are in that setting, in the hospitals, I know they've been talking to you about what critical needs they have right now. So can you share that with us?
Absolutely. Well, for over 23 years, I've been on the front line protecting the footsteps of children around the world from the harm of landmines. And this week, it comes back home to me as a mother of 4 children. My oldest son and his wife are both doctors, critical care doctors here in California. And they are on the front line of this battle of the COVID phantom enemy. And similar to landmines, this is a hidden killer. It knows no borders. And we must, as mothers, as physicians, of doctors, of nurses, of medical frontline workers, be there for them this week. You know, as a mother, we bandaged our children's knees when they fell and they got hurt. We would do anything for them. And this week, I'm calling upon the innovation of the Silicon Valley, the greater San Francisco, to rally the forces to immediately provide them with protective gear, masks, the necessary PPE tools that are needed for them to do their work on the front line of this battle.
So in addition to folks donating masks if they can and, you know, gowns, things like that, there's also an issue of housing, right? I know you've witnessed some just heartbreaking stories of doctors who they can't go back to their own homes because they don't want to contaminate their loved ones and they need housing, right?
Absolutely. Absolutely. My son and his wife have 2 children, and many of their colleagues have children as well. They go out every day on our behalf to protect us on the front line of the COVID-19, this horrible, horrible challenge that the world is facing. And when they come home, oftentimes they can't come home because they've treated patients who are in the ICU or those who have died. And so they're looking for shelter. They're actually, this past week, has had a terrible cold snap in Northern California. They're looking for places to stay. And I've heard firsthand stories. They're staying in garages so that they can get a meager night's sleep and get back to that battlefield on the front line of the ICU. Our physicians, our doctors, our children deserve better. So my appeal today is from a heart of a mother. Let's rally our troops. Let's rally the innovation of the San Francisco Bay Area, the many corporations that allow us to have these conversations online. You know, the San Francisco Bay Area in so many ways is keeping our world together. But we're calling upon your innovation, not next week, but now, to provide the necessary face mask. In particular, the N95 mask is the best that the doctors can use because as they're administering the tubes down their throat, they have to get very, very close to the face.
Yeah.
And
well, Heidi, I know that, you know, one of your employees for Roots of Peace had jumped in to secure some surgical gloves. We appreciate that. And I just want to say thank you for, you know, sharing that message. I know it's not an easy time for you as, you know, a mom of 2 kids in childcare, and then you have an elderly parent, and then you have grandkids. But take good care. We hope to talk to you again soon, and I hope your message
Thank you to
gets through.
ABC News and all the listeners. Thank you, and happy National Doctors Day.
Yes, indeed. Happy National Doctors Day. All right, we'll take a break and be right back.
We are in commercial break.
All right, folks. Hi, Facebook friends. Glad you're all still there. During this commercial break, let me see. Let me check with my producer real quick. We have Dr. Alok Patel's Doctor's Note coming up, right? Okay, so you definitely don't want to miss that because Dr. Patel is always great with useful information that you can take away and bring to your family and share with your family, so you'll want to stick around for that. But while we wait, I just want to bring you a little information on the latest number of cases in the world from Johns Hopkins University of Medicine website. I love this resource because they keep updating it. So right now we have 775,000 cases in the world. Total number of deaths in the world is 37,000. But I also want to highlight the positive. They have 164,000 recovered. So people can get better from it, right? So we can do this. Now, in the U.S., we are now leading the world in terms of number of cases. We have 159,000 cases here. That is significantly more than the number 2 nation, Italy, with 101,000 cases. China now kind of in 4th place with 82,000 cases. And just to break down the U.S. a little bit more, when we take a look at California, we're actually, let's see, 1, 2, 3, 4. We're 4th in the nation in terms of states leading the number of cases. New York is first, then New Jersey, and then Michigan, and then California. And we have 6,500 cases here in California. Total number of deaths, 135. However, there are some signs that our sheltering in place is working a little bit, but we need more. So it's not one of those working so we can stop. It's a working so we need to do more of it. All right, we're coming back on air. Here we go. Time now for a special message from our special correspondent, Dr. Alok Patel. He's part of our coronavirus team of experts. Every day, he's going to talk directly to you in a segment called Doctor's Note. Today, Dr. Patel wanted to share ways you can help even when you're stuck at home.
What's really inspiring is even in these uncertain, scary times, we're still supporting one another. So many people have asked about ways that they can help out while sheltering in place. There's dozens, but I'm gonna run through a few of them. You can help out food banks, such as Feeding America, No Kid Hungry, or Eat, Learn, Play, which is based right here in Oakland. You can donate blood. We have a huge blood shortage right now. You can call the Red Cross, make an appointment, and safely donate and save a life. You can also check in with your neighbors, especially those who are elderly or high risk, and see if they need anything, such as groceries, supplies, or medications. You can also call a nursing home or a homeless shelter and see if they have any needs, or if there's any way you can help them. These are high-risk areas, and you can make a huge difference here. You can even volunteer as an online teacher for the millions of homeschooled kids. You could help out with PPE drives and ensure that hospital workers have masks, gloves, and gowns. In fact, someone messaged me on Instagram asking where they could take a bunch of N95 masks as a donation. They wanted to help. This is America. Even in times of crisis and fear, we come together, unify, and we have each other's backs.
Thank you, Dr. Patel. And I think it is so empowering, especially at a time like this when you feel like, gosh, I have so little control, to take that control and do something positive. Thank you so much for joining us today on this experimental interactive show. Our expert hopefully answered a lot of your questions. We'll get to more tomorrow, so we invite you to take part. We'll be back here and online at 3 o'clock tomorrow with another expert. World News Tonight is next. See you later.
And we are out.
Well done. Good timing. That's a lot to squeeze in.
It was.